Hello friends, welcome back to allornonelaw. This is a medical video lecture, internal medicine. Guys, today's topic of discussion is risk factors for VTE, there's a venothromboembolism. Risk factors for venothromboembolism. Venothromboembolism. Okay guys, so I'm going to talk about these risk factors, very important for USMLE step 2 CK and step 3. Okay, so let's talk about this. First important risk factor that you should know is Washoe's triad. What's that? The stasis, epithelial injury, and hypercoagulability, right? Stasis, venous stasis, endothelial injury, and hypercoagulability. Say, okay, very important. Now let's talk about the other. If the age of the patient, look at in USMLE, look at the age of the patient, it should be more than 40 years, then his risk is a risk for a thromboembolism. Okay, venothromboembolism, remember. Then history of venous thromboembolism, history of, okay, VTE, okay, right. And surgery, very important, because there's no dental surgery. If there's mention of dental surgery which will subside, if it subsides within 10 minutes or 5 minutes or 6 minutes, then it's not a risk factor for venothromboembolism. Surgery requiring anesthesia more than 30 minutes, more than 30 minutes of what? Anesthesia, that's very important. Okay, and the prolonged immobilization, prolonged for days, for weeks, for months, prolonged immobilization. Okay guys, and we have cerebrovascular accidents in the form of strokes, CHF, congestive heart failure, right? Then we have cancer. Okay, then we have fracture of which bones? Fracture of pelvis, femur, tibia. Look at these, very important. Not only you should remember the fractures of just like a, what do you call, of great toe, fracture of a great toe, fracture of the humerus. Just remember fracture of the pelvis, femur, and the tibia is very important. Pelvis, femur, and tibia. Okay, obesity is also a risk factor. Okay, let me clear. Oh no, let me write over here. Then we have pregnancy. Check whether she is a pregnant or not. Okay, pregnancy is risk factor for that, or recent delivery. Estrogen, and we have IBD, inflammatory bowel disease, genetic or acquired thrombophilic states, and air travel. So these are the risk factors for venothromboembolisms. Okay, because this venothromboembolism can lead to pulmonary embolism and sudden death can take place. Usually in USMLE examination, what they give is either air travel in the form of, either they give the history of pulmonary embolism and advise you which of the following should be advised to the patient before going to the trip, what we should do. So try avoiding the, what you call, long journeys, air travels. If you wanna, it's must, then he has to travel, then he can walk, what you call, take a walk in the plane, airplane, okay, or just compress what you call calf muscles, right? So these are other important points. Okay guys, so try to look for these important points. Thank you so much for watching this video. Take care.